Good evening. Welcome to the San Mateo County Dental Society third general membership meeting of the year. Hey, it's nice to get everybody back together after the nice summer we've had. And it looks like we have a really good audience for tonight's meeting. My name is Brad Hart. I'm the 2021 Zoom president of the San Mateo County Dental Society. Before we get started, I want to review again, in case you forgot over summer, how will it be running this meeting? All participants will be placed on mute. Tonight's speaker will provide information about Posterior Composites. During the presentation, you may post a question in the Q&A box. For those participants on your desktop, the Q&A box is located at the bottom of your screen. For those on iPads and iPhones like I am, the Q&A box should be in the upper right corner. Dr. Roetzer graduated from Marquette University School of Dentistry in 1974. Following a general practice residency at the VA Medical Center in Martinez, California, he founded the Martinez Dental Group. Dr. Roetzer's North Bay Dental Educational Center in Benicia, California provides lectures and hands-on training for local dentists. Dr. Roetzer holds patents on several systems for restorative dentistry and continues to serve as a consultant to many dental manufacturer companies. He's also lectured nationally and internationally on restorative dentistry. He teaches 1 day a week at, yes, my graduating university, University of the Pacific, and has provided Dr. Roetzer the opportunity to become, they have given the opportunity to become the director of operative dentistry, a role he plays currently. Please welcome Dr. Roetzer.
Thank you. So let's see if we can get it going here now. All right, let's get started. Posterior composites. Since we started doing posterior composites in the 80s, everybody has complained about how slow they are compared to alloys. The interesting thing is you should not be slower, you should actually be faster, because these things almost never fracture when you're testing occlusion. And hopefully after tonight, we're going to see that you can nail that occlusion almost every time with a systematic approach to finishing these things. So my whole idea tonight in passing on the information that I think will help you is improving the workflow, therefore your satisfaction and profit. It's important that you can do this in a very efficient manner. As Brad was saying, I'm at the Arthur A. Degoni School of Dentistry 3 days a week, operative director, and enjoying every bit of it. It's been challenging during the pandemic, but I can honestly say through our innovative teaching and building some things to let students work at home, like a handpiece system, that they actually could go with high-speed handpiece, and then we could monitor them over WebEx. We kept them on track. Being a 3-year school, we could not afford to lose a year. So it was a very successful thing. We're proud of that. And we hope we don't have to do it again, but if we do, we're ready to do it. So tonight's agenda, what takes us so long to fill and finish class 1 and 2 composites? That's a question, probably rhetorical. Is there evidence to support utilizing bulk fill materials? We'll talk about that. Are processes like BioClear rooted in good science? I'll show you some stuff about that I find very interesting. And then finally, is GV Black rolling over in his grave, watching this stuff like BioClear, or is he screaming, get with it? I was only talking about amalgam when I designed this. So here's where we've come in the last 55 years. Look where we're at on the right now. And now we've got high strength core materials with little tiny pieces of quartz fiber in it now to hold everything together. We've got bulk fills that we can depend on. We've got a BioClear monoblock type system, what is described as injection molding. I'm wearing one on my number 14 that I was told by the prosthodontist that replaced me in the group that I founded needed a crown. When she saw how it was done, she said, I think I want to take that training. That's pretty good. It's been very, very comfortable. And it was a pretty good sized crack on the tooth. So I was happy to have that done, and also happy to have my black triangles closed. So I personally experienced BioClear. The other thing that's happening now is chameleon properties are being built into composites. So when we replaced Premise, I brought in Harmonize from Kerr because it was an agglomerated nanoparticle sized material that competed with Filtek Supreme. And the reason we did that is that Gordon Christensen told me it's good material. He said, I know you want to go Filtek, but give this a chance. I think the chameleon factor was better, is better, and it allowed us to kick a whole lot of shades out of our storage area that we were using for Kerr Premise. And it's a strong material. So two of my favorite agglomerated materials are Filtek Supreme, which works great in the BioClear, and then the Harmonize, and now Simply Shade has come out, which is basically 5 shades. That's it. So I got to share this with you just to give Tracy a little boost here. This was seen in the clinic 2 days ago. Somebody came running up with it, said, you aren't going to believe this. This is a crown. I call this a Guttapercha Post with an amalgam core, okay? First ever that I'm aware of, at least that you could take it out in one piece. So I think what that is either a glass ceramic like Emax or probably zirconia. But what I'm focused on is the fact that there is nothing holding that crown on. So it still seems to be a little bit of fear of post placement. And quite frankly, I can understand why. So I'm going to show you the post system that I hold the patents on that we've had at school since 2009. That Dan Fisher took, embraced, and helped me make it even better than what we first started out with. So this is Unicore. This is a very safe drill. We started with a drill to take out these new posts. And then we realized we had a pretty good drill. Why don't we just clone the post to that shape? So it's basically the reverse of way most post systems were made. This is the array that you get to work with. These are XR quartz fiber. We have been using these again since 2009. It really solved the problem because we don't use a parallel sided drill. The other interesting thing about this post system is that it's reversible. We can take this post out with the same drill that we put it in with. And then we developed also these accessory posts and did some research to prove that we presented at the AADR. And that was to mitigate C factor in canals, because we think that's the reason that a lot of posts came out. And we don't want to take any dentin. We want to leave the dentin there. Whatever we get back from the endodontist is what we're going to use, period. So we can put a small post in and then augment the coronal portion of it by putting in these accessory posts. So this is the smallest zero size post. This is the original accessory point. Then we reshaped that to the Ultradent accessory cone. And it's like sticking in Guttapercha if you're doing a lateral condensation, except you don't condense it. You just slide them in alongside the master post, which has been selected to only fill and fit the apical third. We don't care about that large, unusually shaped part of the canal up toward the coronal portion, because we're going to fill it up with these accessory cones. So they're inserted, and the core material, of course, generates a lot of setting stress at the dentin bond, and that's what we're eliminating because the accessory fiber cones don't. So this is what we did to prove the strength of this. We found that 3 out of the 13 products that we tested were superior in diametric tensile strength. Those 3 are the XR fiber from RTD, who makes our post, Viscous Post, 3M's Post, and a couple others. We were happy to see that we could verify that. And then we did this push-out strength test with the accessory points and also with quartz fiber stuck into that big area around the coronal portion of the post. And what we found is that we could increase the push-out strength in the critical part and eliminate the possibility of losing that because of the breakdown of the bond from C factor. So that was a fun project. Bulk fill materials and systems. The earliest bulk fills were the glass ionomers, and they served as dentin replacements for decades. Ionic bond to dentin, fluoride release, it makes them work. The coefficient of thermal expansion close to dentin, perfect for a base material. Dr. McLean in London described the sandwich technique in '85. A lot of people still use it. You could have a closed or an open sandwich, covered or not. So you knew that the deep boxes were being filled and there wasn't a problem. Not aesthetic, you can't polish it, you have to cover it with composite and you can't bond to it. So if you add a little RMGI for better properties, then you get a bondable fluoride releasing type material. And we'll talk about some of those, especially Activa by Pulp Dent. We've done a lot of work with that, with its flexible monomer and its calcium phosphate release and exchange of fluoride. You got a pretty neat material and you can bond to that. So bulk fill versus incremental. We still teach the incremental technique at school because we know people are going to go out and they're going to be encouraged to do that in the practices they go to. Most of the dentists in the United States are still using a 2 millimeter increment technique. So traditional placements, 2 millimeters of a universal or even a bulk fill. We found there's no difference, and it's in the literature in horizontal versus diagonal increment placing. I think if you try to do things diagonally, you can actually create some voids and porosity and possibly even some marginal gap. So just pack it in horizontally in 2 millimeter increments. Now the polymer advances, the photoactivation and curing units have improved to the point now where our bulk fills are now possible up to 4 to 5 millimeters with proper curing. The bottom layer, keep this in mind, this is your bottom line on your bottom layer. It needs to be able to get to 80% of the top layer in hardness, and that's in Nup units. Keep in mind that these LED units have really improved our workflow. The Velo is what we use at school. We love it. They can run over it with their, with their cart, with their chair. It doesn't hurt it. Drop it on the floor. And believe me, students test that. And it's been great. Always important to check power density of the quartz tungsten halogen, as well as the LED lights, and make sure that you have the appropriate radiometer to test that. Forget pack lights. According to Richard Price, they never did really work very well. It's like also trying to polymerize with a laser. That was pretty much a failure. So what do you think? Altered composition of translucency? It allows increase in depth of cure. So they've figured out how to do this. Less polymerization, shrinkage, and shrinkage stress. Elastic fillers, more or different photo initiators, newer types of monomers. You'll see one that 3M just introduced that minimizes shrinkage. Shrinkage was always our problem with postoperative sensitivity and leakage. So since 2001 now, we have evidence that bulk fill creates no more cuspal deflection than incremental placement, and that is predicated on using materials that have been vetted, that we know are good bulk fill materials. The main issue with the bulk fills, again, is the depth of cure. We recommend lateral proximal wall curing to help with that issue, as well as the occlusal application. So what about these paste versus flowable bulk fill composites? Paste consistency works well. You can use it cold or you can use it heated now. Now we're heating to about 150 degrees. The nice thing about heating is it flows much better than cold. Claims are that the marginal adaptation improves with heat. I think that's absolutely true. The chemistries are enhanced to minimize polymer stress. Typically, you're going to go 4 to 5 millimeters depth of cure. The ANSI ADA spec 4049 is the one that states the bottom layer must be 80% of the top layer hardness in Nup units. They use either a scrape or what we call a micro indentation test. The micro indentation test is the most accurate. You can do your own test by taking a piece of black irrigation hose, cut it to about 4 or 5 millimeters, pack it full, and then push it down on some black surface and light cure from the top for what they call their appropriate exposure time of the light. And then just push it out and look at the bottom layer. If you can push in 1 millimeter on a 4 millimeter material, something's wrong, either your light or the material. I think if you use the vocal material you're going to see, or the 3M bulk fill 1, you're going to see that at the 4 millimeter that they claim, you're going to have 80% of the top layer hardness. So typically with these, you want to cure occlusal, buccal, and lingual to achieve that maximum depth of cure. Then what about bulk fill flowables? Remember, flowables have been around now since the early 80s. We used to use these in the prosthodontic office I worked in to weld, if you will, segments of full arch temporary bridges together. It was made by Cure. Nobody really appreciated where they were going with that. It obviously has changed the way we do dentistry, but that was the first one. It was called paint on resin, and it worked well. It was purely light cured. Low viscosity. It allows a small needle for preventive resins. Our flowables have really come around. 2010 bulk fill flowable, smart dentin replacement, SDR by Dentsply. First bulk fill flowable, strictly light cured, good dentin replacement, very highly rated by all the agencies that are independent. Then since then, you got Tetric Evo Ceram Flow by Ivoclar and Mira Extra Base by Voco, Venus Bulk Fill Heraeus Kulzer, Hyperfill DC by Parkel, Beautiful Bulk Flowable by Shofu, Filtech Bulk Fill Flowable 3M, Injectafill DC, that's Apex, now Apex Vista, Bulk Easy by Danville, now Danville Zest, and Activa Restorative by PulpDent. So keep in mind that Injectafill DC, Bulk Easy, Hyperfill, Fill Up is, I don't think I mentioned it. Fill Up is a Coltine product, European product. Activa, they all have unlimited depth of cure because they have a catalytic part of their setting mechanism. If you let the catalytic work first, and it's going to be variable, like Bulk Easy is only 90 seconds. Who doesn't have 90 seconds to wait to get a perfect margin and an absolutely perfect bond to the floor? Allow it to set whatever they say is their catalytic. So Activa may be 2 or 3 minutes, but it's going to eliminate the possibility of having shrinkage stress and debonding. And then you can photo initiate the composite. The dual cure flowables with unlimited depth of cure and dentin-friendly viscosity will adapt really well without manipulation. And that low polymerization stress when the catalytic reaction is allowed to complete is absolutely great. So clinicians are either capping with a universal or they're allowing the flowable to be the cap. The wear rates on these materials look very good. Keep in mind that we always considered our best wearing composite for posteriors to be heliomolar, which wasn't that highly filled. So how about 3M1 bulk fill packable that you're going to see in the BioClear technique? That's what they use. So if you have a class 1, they're saying your increment depth should be 4 millimeters. If you got a halogen light, hit it 40 seconds. With the SB LED light, which would be the same as the Velo, 20 seconds. If you're doing a class 2, you're talking about an increment depth of 5 millimeters. You better do 20-second occlusal, 20-second buccal, 20-second lingual. If you're using the SB light or the Velo, 10-second, 10-second, and 10-second. So one material for the entire restoration. Who could ask for more? Requires a good wedging and robust rings to assure a good interproximal contacts. We'll go over that. Non-sticky, it's got a great chameleon effect and it polishes well. Can be used either heated or room temperature. If you heat it, heat to 150. Use a good caps warmer like Adent makes one, BioClear makes one. There's a bunch of them out there. They all work well. It's used extensively in BioClear injection molded process in the heated state, along with their Filtech bulk fill flowable. Reality gave this a 4.6 rating, so it's got good thoughts behind it. The bulk versus incremental filling in the in vivo study results. Here's a class 1 and 2 composites. The average placement time, you can see incrementally placed bulk fill versus bulk fill. There's a big time savings. There's no question about that. And the results of this study are showing that 50 to 60% less time, about 17 minutes to place a class 1 and class 2 restorations when bulk filling with selective enamel etching. Bulk filling didn't increase the risk in this study or the intensity of postoperative sensitivity. So do the math over your career. That's a lot of money to put in your 401k. This was a randomized, double-blind patient and evaluator clinical trial, 53 cavities per group, bulk filling versus incrementally placed posterior composites, total versus selective enamel etch. And the materials are 3M Filtech 1 bulk fill restorative and 3M Scotch Bond universal adhesive, done in Brazil. Excellent study. So what is the evidence-based choice? This was impressive. This addition fragmentation monomer reduces shrinkage stress. The addition of that in the dimethacrylate network serves as a useful and potent additive in reducing shrinkage stress in polymerizing networks. Now you'll remember back in the 90s or early 2000s that 3M came out with what they called LS, low shrink. It was a ring opener rather than a ring closer, silarane type reaction. The problem was you couldn't use typical bonding agents. You couldn't use one step from Visco. You had to use this bonding agent made for ring openers. So it wasn't a real popular material, but it was the first one to really bring shrinkage down. So I was visiting in Europe, Ivo Krejci, who is the master compositologist and researcher in Geneva, Switzerland. And he was telling me he was using his typical bonding agent first, and I forget which one it was, and then he'd cure that in the cavity, and then he'd place the silarane bonding agent over that, and then he'd place the LS. That's too much work for me. But the bottom line on this is a paper done for the Society of Chemistry, Polymer Chemistry 2017. And what they're doing is an addition, fragmentation, chain transfer, monomer, and a dimethacrylate network formation to reduce polymerization, shrinkage, stress. That's what we want to do, period. So look at 3M's depth of cure. There's Filtech 1, looking real good. And you'll notice that when you see Avoco and some of the other materials out there that are considered bulk fills, they're going to be right in that neighborhood. But what they're comparing here is to the typical materials that a lot of people are still packing 2 millimeter increments in. Here's Dental Advisor. They gave it a 4.5 star. That's pretty high rating because Dental Advisor only goes to 5. And the consultant's comments, you can see easy handling. That's important and packable. With the convenience and speed of a bulk fill, great blending ability, polishability, nice final shade, adapts seamlessly to the tooth, placed well in bulk. For pediatric cases, really great for single increment. Now, here's
a quick question.
Yes.
Does heating it change any of the physical expansion on the composite, was asked?
No. The studies have been done on that repeatedly, and they found, I can dig those up for you. I didn't have time to put them in here, but I can find that for you. This is Brad, right?
Yeah, it was a question that was asked by one of our persons reviewing your program.
No, it's not a problem. And in fact, the other questions that's frequently asked is it going to damage the pulp? And we've done exhaustive studies on that at all the companies that are doing heated bulk fill composite, there is no danger to the pulp. And when this material comes back to its normal, body temperature, it's not a problem. And what I really like about it is the way it flows into the nooks and crannies. So let's look at a typical Richard Young case. He's at Loma Linda. He does a lot of really great photography courses, as well as being a senior mentor for BioClear. So what he's showing you here is pre-wedging to separate those teeth. That's a diamond wedge. You can buy those from Clinician's Choice or from BioClear. They both share that. Then he discloses. It's the best disclosing material I've ever seen. It picked up the crack on my tooth on number 14 that the prosthodontist couldn't find with her solution. And once you got that on there, it's pretty impressive. You see how much plaque is on there. Try and take that off with a brush. Good luck. So what they recommend is an aluminum trihydroxide water slurry blaster, because you can go below the gum line with it. You're not going to get an air emphysema. The nice thing is it just cleans all the biofilm off of that tooth. So once they have the initial prep, then they can go after the little, nuances like that white D-min you're looking at, which of course has to come out of there. So here he's ready to go. Now look at the bevel on there. You think GB Black would be wigged out about that? What he's doing is converting the ratio of dentin to enamel. Then they put that anatomic matrix on there, which is gorgeous. And then they injection mold it with heated material. In this case, it will be 3M, bulk fill, flowable heated, and paste heated. And they really inject it. It goes right around the corner and fills up that big radius bevel. And then they spin out the matrix, and that's what you get. Now that detail on there is what I call the BioClear cartoon anatomy. They don't really go into much anatomical form, but you'll see after giving them these sculpting burrs that I developed that they can now put some pretty nice anatomy into these. But look at the margins on this. I've looked at the 15 to 20 year recalls on this, and they look beautiful. It's not separating because of the cleanliness of that surface when you etch and bond it. And they're converting the ratio to 70% enamel to 30% dentin, and that yields a C factor of a class 3 restoration. So you don't have to worry about these things being sensitive. I can tell you it's the most comfortable crown I've had out of the 5 or 6 that I have in my mouth, including gold and Emax that's milled and Emax that was sent to the lab. And then this one, this is the most comfortable. There's the margin you see. Beautiful. So what does Christensen say about this? He sent me this letter when I developed the Raptor burrs, because I've always believed in monoblock compositing. Any way that we can get a monoblock, I don't like layers of composite. He also advocates that. He thinks that additions, especially when we had these failures of these polymer crowns, he thinks that the additions and movement of unpolymerized composite can result in gaps. So if you allow the material, when you're packing material into your cavity of a class 2, do about 10% above grade and then sculpt it, and you'll have a monoblock. Avoiding soft sculpting, I think, is a great time saver. Now here is the newest addition. This is thermoviscous bulk fill Viscolor. 2 modalities. What I like about this system is look at the narrowness of that tip. It actually will fit inside the lumen of the 3M tip, and the 3M tip is already small. So you got 2 ways to do it. You can use that caps warmer on the bottom, which is probably what we're going to go with at school. Or you can use the gun. The gun will heat it. It has a special capsule that will allow it to heat with infrared. So here's the process. After the cavity is cleaned and prepped and ready to go, apply your bonding agent. In this case, it's for Futura Bond. This material is compatible with any bonding agent like Scotch Bond or Prelude or Cure Erase products. And then you have the two warming options. If you use the caps warmer, you stick these things in, it's going to take about 3 minutes to heat that cap. You have 20 seconds from the time you push it into the gun to use it. So you don't have a lot of time to waste here, but that's about all it takes to fill an entire tooth. The preheating time is how much time do you need to allow when you come into the operatory to turn that thing on and get it ready? 15 to 20 minutes. Some people just leave them on. Now the Viscolor dispenser is different. The cap's warming time is 30 seconds once you turn it on. Processing time, 2 minutes, 30 seconds. You got a lot of time. You don't have to worry about material hardening while you're waiting to do it. So what about their technical data? Shrinkage, very good. 1.44, 335 megapascals in compressive strength, pretty impressive. Of course, these are internal values. Just keep watching all the big three and see how they report on it. Micro hardness, Knoop units, Viscolor bulk, very high. This is a German study. But here's the big deal with these bulks. Look at what they're showing here. They're showing placing a restoration with flowable material, 2 millimeters of composite at a time. So bond, 35 seconds. Coat the bottom layer with flowable, 20 seconds. Light cured, 20 seconds. Applying the first composite layer, 20 seconds. Light curing, 20 seconds. Apply the second composite layer, 20 seconds. Soft sculpt it and then light cure it, another 50 seconds total. 3 minutes, 5 seconds, minimum 2 caps. Now, placing a restoration with bulk flowable and bulk fill, there is some time savings there because you're applying, you're bonding, same time, applying the bulk flowable material, 20 seconds, then light curing it, 20 seconds, and then applying the sculptable bulk fill material, 20 seconds, sculpt 30 seconds, light cure, 20 seconds, 2 minutes, 25 seconds. Now placing a restoration with Viscolor bulk. Bonding, 35 seconds. Applying Viscolor bulk, 20 seconds. Sculpt it, 30 seconds. And I don't even do that. I go right into sculpting it with my burrs. And then light curing, 20 seconds. So you're saving with those 4 categories, it's about 1:45. Now, I don't know where they got 70% because when I do the math on it, I get 40% faster, which is good. You know, anybody that can save that much time on every procedure, that adds up in your schedule, especially when you're doing quadrant dentistry. So what's Bulk Easy? That is a Danville product. Sean Chen had just started there when I was leaving. I worked 4 years for Ray Bertolotti in 2000 up to 2012. Started there in 2008. Had a lot of fun working with Ray because he is brilliant. He's a very interesting guy. And he brought on Sean Chen, who came from the Kerr company. He was responsible for a lot of Kerr's products. This was a real boon to dentistry as far as I'm concerned, because Bulk Easy, you really can't screw this up. When you fill this and let it set for the 90 seconds, your margins are going to be impeccable in the box form and at the occlusal. You just don't get the shrinkage, or you get the shrinkage, but it's controlled shrinkage. So here's what happens. When you self-cure, no light, you have unlimited depth of cure. You get the smart polymerization, it's directed shrinkage. The curing happens evenly in the bulk, with the bottom part curing slightly earlier, so the gingival margin's well sealed. It's fully compatible with all bonding agents. Also keep in mind is it volumetrically shrinks because the top layer is still soft. It's going to pull it down. We did that measurement in Bisco in 1992, and it was amazing how that can cave in when we were working with materials like BizFill 2B and AutoCure bulk fill material. We've known this for years, that if you let things go AutoCure, they pull down from the top. You don't hit that with the light until that catalytic part is gone. So I call it Bertolotti's baby. It harkens to the days of Bisfil 2B at Bisco, which was a pure auto cure. This is a Bulk Easy is a dual cure. You will increase the polymerization, the cross-linking, the physical properties on the top of that material and probably a couple millimeters down by adding light, because you still have camphoroquinone in there, which is a great, one of our earliest photopolymerizers. So B stands for Bisco, B for Bertolotti. Here's the micro leakage study on Bulk Easy. It's not a coincidence that Bisfil 2B also did not suffer marginal gaps. I talked to a friend I worked with in 92, a Canadian guy, and we were talking about all the things we did. And when I told him that I had gone to incremental packing, he said, "Oh no, you went to the dark side." I said, "What?" He said, "I never gave up with Bisfil 2B. And I got to tell you," he says, "as I cut through these later on in life, I see no leakage at all." So follow the studies that Christensen has done on our class 2s on incremental. It's not that pretty. Now look at this. This is Bulk Easy. But what, or not Bulk Easy, this is showing what happens when you've got materials that are undercured in the adhesive and the composite interface. You get a gap. Even at 5 millimeters, that last little bit is not closed. Same thing with the 7 millimeter. So it's critical to have all those deep margin seals. So this goes way beyond what we used to call the white line margin defect. So this is a study where they're showing marginal adaptation of class 2 cavities restored with bulk fill. So before loading, all of these groups had fairly good results. Marginal adaptation at the total margin length expressed as a percentage of continuous margins. But then when you load it, all of a sudden you start seeing some of these open up. And believe me, your patients are loading stuff up. So you had acceptable margins, and then you loaded the restoration and it decreased the acceptability of it. So in terms of micro leakage studies, Bulk Easy had the least micro leakage at the interproximal margins. These are internal Danville data, but the fact of the matter is we've done our own little studies. I can't go into it now because it's a whole bunch of slides showing how well this seals at the margin. But again, you must allow 90 seconds auto cure before light application. Otherwise, you're cheating yourself. So here's a comparison of some of the interproximal margins. You can see Bulk Easy has very little to no leakage, whereas look at the other materials, Bulk Fill M, Bulk Fill K. You can't see D on there. But what you're looking at, micro leakage scores, is that Bulk Easy is 0.2 plus or minus 0.4. The other is 2.8 plus or minus a lot of leakage. So polymer shrinkage is offset by that occlusal drawdown that you get because the material sets volumetrically. It's smart polymerizing. Now, what about the bonding compatibility? Keep in mind, I showed hyperfill by Parkel and fill up by Colteen. You have to use their bonding agent with that. You can't use typical bonding agents. You just won't get the bond strength. Bulk Easy, you can go with any bonding agent, it will work. It's compatible. Parkel, Hyperfill, and Colteen Phillip, only their adhesives. This is showing the radio opacity, 320% of aluminum. It doesn't get any better than that. Ray loves this stuff for margin elevation, as do I. The important thing is that you get a good seal on that box, and we'll show you later on how to get a good seal in those real deep boxes where you want to do an onlay, but you're so far below the gum line that you just know you're going to have to do something, either surgery or figure out a way to elevate that margin. This is a great material for elevating margins if you follow the rules. So you can see the deep margins on here. This is a case that I did. This is a nightmare margin. After this tooth came out, this is what you have. So what are we going to do with that? We're going to restore that. We're going to use a band called a Paraban. You may know it as greater curve. If you don't own it, buy it. It's a great band for this type of stuff and for margin elevation. So this is what it looks like. Practicon sells it as Paraban. I think you can get the greater curve from some of the majors, the vendors, Pearson's, the Pattersons, etc. This is geometry at its best. The guy that figured this out is somewhere in the Midwest. I talked to him when he came out with it, and he was just really thinking, you know, dentists are great diddlers and thinkers and engineers and micro engineers. This thing works. And I've used it on anterior teeth also. When I'm doing post and cord, I got to separate teeth. It works beautifully. So this is available through Practicon. So here's that caries. That's my first cut into it. There's my final cut. I can see I'm no caries remaining. There's a 15-second fill. That's how long it took me to fill that. And there's the 4 Mylar discs. Now, the student could have done that a little bit better. I don't have a final picture in that. I said, get them back in and flatten that a little bit. It's too bulbous back there. But you can see how the Paraban works, because if you look at the 15-second fill picture, you can see where the Paraban was. It's that straight line. And then we rounded it. This is another deep fill filled with the Paraban. Now, it's reasonable to say that most docs would defer to amalgam or GI with this box step. You don't have to worry with Bulk Easy. If you can get it dried on there, then Bulk Easy is your game. Ray loves to use trichloroacetic acid for that real stubborn bleeding in a deep box. He says trichloroacetic acid, which you can get through I believe through your compounding pharmacies. It's used extensively in dermatology. I asked my dermatologist about it. He said, oh yeah, we use it all the time. Now, why does that work better? It just does. It's a great astringent material, but we don't use it at school because it's not really on our formulary. We're still using our viscostat and our astringent. So yeah, I really like that marginal adaptation. That's a quote from Will Milkovich, US Navy. I visited him. He was class of 2015 at the Trident Sub Base in Washington, Puget Sound. And he's nicknamed Take One because his girlfriend, who became his wife, took 5 impressions. And I looked at him when he was ready to take an impression. I said, so you're gonna take 5 impressions? He said, nope, I'm taking 1. So it became Take One, became his nickname. So I gave him this material. This guy, Submariner, shows up with a large alloy, fractured cusp, and he's shipping out in a couple of days. No time for a crown. So he filled it. This is his first restoration. He filled it with the Bulk Easy, and he said it was beautiful, he said. So physical properties, they will support a single material fill, or you can cap it with universal. But look at the compressive strength and the diametric tensile and the flexural. It's a good material. Bulk Easy's wear, it's pretty low. Herculite's much higher. And there are still people that like to use stuff like Herculite in 2mm increments. Not necessary. I have a guy that I recruited up in Redding, California, Mike Nelson, who is, I'm understanding now, talking to a couple of guys up there that I know, specialist. Mike has become the dentist in Redding. I recruited him when we were coming out with new products at Danville. And Mike told me the other day he's placed over 2,500 Bulk Easies, and he's reported no significant wear on them. And this guy really checks. So what about geriatric crowns? Here's Gordon talking about this. You got an 80-year-old patient, needs numerous crowns, needs replacement, no insurance, the perfect storm in your practice. So what Gordon says is use Danville Bulk Easy or Hyperfill by Parkel and make a geriatric crown. Now, I would like to eliminate the risky step of doing this in the mouth. So what I'm going to do is make a Mach 2 or a slow Mach model, which is a highly filled silicone dye material. So I'll take a pre-op impression with clear VPS. That's my matrix. If I'm missing a cusp or something, I'll just build it up quickly with a little bit of flowable. Before I take my impression, I prep the tooth, take a VPS impression, spray it with silicone mold release, pour the model in Mach 2 disilicone. We're talking minutes here. The longest thing you're going to do is prepping the tooth. And then I fill that matrix, that clear matrix with Bulk Easy, insert the Mach 2 model into it. The Mach 2 model after 3 minutes is ready to go. And then I can separate the dye with the crown on it and finish the margins in my hands. No risk of getting it stuck in the mouth. You get one of these stuck on, and it's very difficult to get it off. And you're not going to be using Vaseline in there, because that's going to screw up your bond, because you're going to create a little cement space in here if you have to. The dye material is very accurate, so it's going to fit closely. So if you have to, you just create a little bit of space in there and micro etch the intaglio and then bond it on the tooth. Look at Martin Tellich's article. Martin is a DDS, PhD in materials in the Midwest. He wrote one in July, August in Dentistry Today this summer. It's really a well done article, and it describes this technique using nano materials. So this is what I'm talking about. Let's say this is this guy right here, got a big old amalgam, cracked cusp, no insurance, 78 years old, cardiac history. I take my clear tray. I buy these from Affordable Dental, great tray, very easy to heat. If you want to flex the flanges out more, very rigid once it cools. I take my clear silicone. You know, everybody's making a clear silicone now, so it doesn't make any difference which one you use. I prep. I like a 2 millimeter occlusal clearance with rounded internal angles. You got a lot of different thickness gauges that will help you to make sure you're getting the right thickness. Common sense makes one. Contact Easy has the prep sure, because you're not going to have any kind of a scan to tell you if you prepped off the right amount. So make sure you're getting that 2. And then you spray that model. There's your VPS impression, 3M light body, Penamix. There's the silicone mold release. It's Huron Technologies in Michigan. Just look it up, Huron Technologies, silicone mold release, not a dental product. And it works much better than the stuff we buy from Zahn or any of those. Now, Bisco, we made this material. I was part of this project. We made this quick dye material, but it really got shut down quickly when Parkel saw that Bisco was making this. And quite frankly, it wasn't as good as Parkel's Mach 2 or Mach Slow. Mach Slow is nice because you got more setting time. Volco's disilicone, also not as accurate. So what did that give me now? I have a model. I poured on a vibrator, 17 gauge tip provided. The interesting thing is in 2 to 3 minutes, this model is ready to go. So here it is. We pour a base with bite material. I like to have, you know, a pretty good base on there. So I'm not going to have any flex of the model. If you want to get fancy, you can put a clear incisal composite, the cusp tips, use like a zirconia-based nano, and then use an A3 or a central A2, whatever you want to do for the body. Fill the matrix with Bulk Easy, inject into the boxes along the margins, and then seat it and let it polymerize. Now, quite frankly, you don't have to get that fancy. You could just fill the entire clear silicone mold with Bulk Easy and slip the model into it. Because if you do it the way this is described, what's going to happen is you're going to have to, at some point, light cure that zirconia-based top layer and light cure that molar, the A3 or A2 that you've used to create the body of it. Whereas the Bulk Easy is just going to set by itself. So how would you set that? If you elected to do it with that fancy material in, you'd stick it in a triad for 10 minutes. and you will get a crown out that runs beautifully. Keep in mind that 10 minutes, you will kick up the conversion rate of this material very well. So there's what it looks like, completely set, ready to die trim. I cut swales in that model if I'm going to be using the thick material. And this is actually done with thick composites, paste composites, and not bulk fills. So dye removal with a scalpel. And now you've got a crown that you can finish and cement. So these are both recommended for the geriatric crown, Hyperfill by Parkel, Bulk Easy by Danville. Keep in mind the quickest way to, and now add Luxacrown to it. Luxatemp, Luxacrown. The Luxacrown is a very hard and durable material. It is meant to make the geriatric crown. So you got 3 options to do that. I wouldn't even fool around with that technique I showed you, adding the occlusal material and then the body material and then using the A3 or whatever, Bulk Easy or Hyperfill. I would just make the whole thing out of Hyperfill and Bulk Easy because quite frankly, the patient is probably not impressed with your clear cusps, and all they want is something that's going to chew well. So I thought you'd be interested in seeing this, because this is a private conversation with Mike Miller, a founder of Reality. Also, he's an associate professor at UT Houston. And what he is showing here is the software program that he developed for Reality to calculate percentage of voids at the margin. Sonic Fill 2, manufactured with an enhanced process, improved marginal voids. What they did not take care of is sonicating, bulk fills, and universals will actually create a Swiss cheese effect. And I'll show you the slides on that. Now, if you take Bulk Easy and deliver it through a 19 gauge needle rather than the 17, it dramatically improved marginal adaptation. So this is presented IADR April 2017, San Francisco. There's Sonic Fill 2, the original, 0.186. Now, and there's Bulk Easy, 0.168. Now, with the new Sonic Fill formulation, they dropped that down to 0.042. Pretty impressive. Bulk Easy went way down, 0.017, just by switching to a 19 gauge needle. My feeling is that it slows you down, so you're not going too fast, and you're allowing that material to slump and go where it wants to go. Now, regarding sonicating material, this is a very interesting study. And what they're showing here is if you take that Sonic Fill tip and you load it up with A1 Herculite, you can see that the A1 packed conventionally looks like that. Now, ultrasonic it, you get a lot more voids internally. B1 is Sure-Fill, SDR, conventional, very few voids, sonicate it, and there you go, you get this, I call it Swiss cheese. C1 is Tetric Evo Ceram, bulk fill, conventional, sonicate it, and you get the Swiss cheese. Now here's a sonic fill just packed conventionally, and then sonic fill in D2 sonicated, and you get this effect. I showed that to our Kerr rep. He hadn't seen it yet, so I don't know how they're addressing that, but you need to be aware of that. Now, what about these products? What about the bioactives? We're currently using the Activa bioactive liner, base liner. It's really a nice material. It does good fluoride release, and you're gonna put this down before you etch and bond, because you want that to penetrate in the dentin just over your deep areas. Bioactivity or Activa bioactive restorative is a true restorative material. So you have the base liner and you have the restorative. You don't have to use the base liner with the restorative. You can go right on your bonding agent with that. It has the same properties, it's just more highly filled. So Activa contains this rubberized urethane. It's an interesting material. It's patented. It's a urethane molecule that will provide unparalleled toughness. They put it in their temporary, their tough temp. You can bend a tough temp temporary, it won't break. It's very interesting material. So the following tests were done with Activa bioactive restoration and liner. You can see all the different things that you're looking for to classify something as a bioactive restoration. And compared to composite, the restorative flexural value 105 megapascals, flexural fatigue 63. Pretty good material. Here's a good representation of this rubberized urethane diurethane dimethacrylate molecule that actually gives this material flexibility. Now, keep in mind that bioactive materials are dynamic. They're considered to have smart behavior if they have the capacity to interact with living tissue or systems. They can react to changes in the oral environment. They can bring about advantageous changes in the properties of the material itself or the material tooth complex. Well, by the way, John Comisi did a lot of that. John is a very good researcher. He's at the University of South Carolina doing some really nice work on materials like this. The oral environment is exposed to continuous pH cycles. Saliva and tooth structure participate in a constant cycle of mineral exchange. pH is low, demineralization process releases calcium and phosphate ions. As the pH rises, these ions interact with the fluoride ions in our saliva and precipitate onto the teeth in the form of acid-resistant fluoroapatite. Bioactive materials participate in this ionic exchange, kind of a magical process. But look at Activa Restorative. They're comparing here to Filtex Supreme. Pretty good in compressive strength, pretty good flexural strength. DTS, good. And look at the wear rate, the same as Filtex Supreme. This is a material that you can use with great confidence with people that are suffering from just poor chemistry, where they're getting a lot of recurrent caries and a lot of erosion. This is the material I would use. Meth addicts especially, you got to have something that's going to exchange, that's going to keep them from losing their teeth. This is a fast material to work with. This is unbelievable. This is Cured Activa Restorative. I'm bending that. That's my fingers, 3 millimeters flexure to failure. So this is really great for class 5s. Now, what about if you got John Kanka together with a guy named Lamoran? He is the CEO right now, but he was of Vista Apex. He's also the guy who was lab director at Bisco when I was working there. So if they decided they were going to do an exchanging of bioglass material that also releases fluoride into the dentin. So what they're saying here is that we don't think if you put a bonding agent down and then you place something like Activa Restorative, that the ions are going to penetrate that hardened bonding agent. So they decided they're going to put it in their bonding agent, their bioactives. John is a guy that believes in 5% nitric acid with a pH of 0.9 as an etchant cleanser. You don't rinse this off. You put this on like you would phosphoric acid and it will self-neutralize. So you can use it on the dentin and the enamel. So this is like a 5th generation. Universal's treated like a 5th gen. And when you put that material into the dentin, it actually has the bioglass particles in it. It's got primer, adhesive, and bioglass in suspension. And it also contains MDP. It's a real interesting material. So what they're saying here is don't let your bond be the barrier to bioactivity. If you look at the 2 products they have the 3 bottle, which is like the 4th generation material, and then they have like the 5th generation. So bottle 1 is etchant cleanser, 5% nitric acid, 10 seconds on cut enamel. They say 20 seconds on cut or blasted. And then it's a 3 bottle, just like the 4th gen, 1 bottle like the 5th gen. Bottle 2 now in that 3 bottle system is the primer with the bioglass. You simply paint on the dentin, no scrub in bottle 2. Bottle 3, now on the other hand, is an unfilled resin. You have to place that and aggressively air thin it. And they say that their film thickness is 10 microns. So the unfilled resin brushed onto the bioglass primer diffuses the ions into the dentin. They're getting a lot of attention with this because we do want that bioglass to penetrate dentin. If there's any question at all about whether Activa can penetrate the cured bonding agent, it should be addressed. And they claim at Pulp Dent that it does penetrate. So just keep yourself posted because a lot of people are looking at these 2 approaches. So the current adhesives show great bond values to dentin, but release of calcium and phosphate as well as fluoride into the dentin is questionable, according to some people, Rella Christensen being one of them. Put the bioglass in the adhesive and the composite as well, so that the bond does not block perfusion into the dentin. So just keep this in mind to encapsulate this. Activa is going to release on the interproximal box areas, on the occlusal areas. It is going to do your exchange at that level. The question is it really exchanging ions into the dentin? Because we have all sorts of hopes with that we can get rid of the problems with cathepsins and MMPs, the metallo-metal proteinases that eat our bonds up. That's the great hope. But we have to see, we have to have independent evaluations of this that show that it is going to work. We've been using Activa restorative at school, especially in the pedo department, and we're using it with the bonding agent. We're using it with Scotch Bond Universal. We've actually measured 37 megapascals of shear bond with it. That's very high. So here's the slides. Now, these are regen slides. They're saying calcium release versus time in days is a lot higher than pulp dense is. They're also saying that the phosphate release is higher, not that much higher, but these are big claims coming from the 2 giants in the industry. John Kanka and Scott Lammerand have been around a long time. They've been groundbreakers in adhesion. John is generally credited with wet field bonding, with total etch bonding. So it's not like he doesn't have a good name. He's worked with Lammerand since '92. So fluoride release, they're claiming much higher fluoride release. So just watch for the reports from the big 3, from CRA, Reality, and Dental Advisor. Now we got the materials, but what about the accoutrement to ensure great margins and contacts? This is dual force. This is clinician's choice. We use Garrison at school. We love it. Garrison is great, but I can't use Garrison if I want to do BioClear. This works for BioClear minus the matrix. I'd still have to use the BioClear matrices, but the matrices that come with this product are excellent. This is what they look like. They're kind of huggers, if you will. They call it the Ultra Wrap, 4.5, 5.5, and 6.5. And you can see it's very close to the way the BioClear looks. So dual force, again, the same wedge as with BioClear. They share this. These rings and wedges combined will produce 8 pounds of separating force. That's a pretty good selling point, especially when you're doing back-to-back composites. Let's go on to lights. The Velo cordless, we have tested that. We've tested it as much as anybody could possibly wish that they had a light tested. There's no way you're going to break that light. I was there with my post system working a lot at Ultradent when they were developing this light. I saw how they built this. It's incredible. This is right from the bench top up. These aren't, off the shelf LEDs. They were made to do what this thing does. Now you're going to see this new kid on the block, and this is from Scott Lamarand and his Apex Vista group. It's called Pink Wave. And what they're claiming is that it's got quad wave technology that offers a decreased composite shrinkage and increased depth of curing. Is that true? I don't know. With the largest curing light area, quad wave leverages 4 wavelengths into one collimated pink beam, UV, blue, red, and near infrared. So again, these need to be evaluated. They will be, believe me. You gotta love that large head area, but the claims are what we all want, but it needs to be verified. Now, we haven't tested this at school. It would be a real good test with some of the equipment that we have in terms of top and bottom layer and shrinkage and all that sort of stuff. So we'll see how we do. But if there's 2 lights that really work well, the people that are using Pink Wave, like at Catapult, are saying they really like it. But does that really satisfy you when you're looking for data? Probably not. If you're going to look at buying this, though, I would definitely call Vista Apex and ask to talk to Scott Lamran personally. But again, watch for reports from CRA, Reality, Dental Advisor, all the people that do great testing. Now, here's an important thing to consider. Budget curing lights. This is Richard Price on this and his son. And Fred Rugeberg also is probably one of the best physicists that you'll find in dental curing lights. And what they're saying is be very careful what you do. Richard is the inventor and developer of the Mark light. It's a curing calibrator. We can calibrate our faculty as well as our students to make sure that they're getting proper angulation and they're getting light to the bottom of the prep. That's why he invented this. But keep in mind that your radiance values reported by dental radiometers don't adequately describe the output from curing lights. Budget lights don't provide consistent performance. Their light output at the tip was highly inhomogeneous, and it doesn't cover an area as large an area as lights from major dental manufacturers. So keep that in mind. You could really compromise your lateral layers with a light like that. The other thing that's important is the influence of battery levels. So there are some limitations on this study, but they concluded that the different battery levels of a cordless LED affected the battery voltage light intensity. That's going to influence the degree of conversion of your polymer. Diametric tensile strength will be messed with, absorption, solubility of the nanofill composite realm. You got to be really careful that these are charged up. Now, moving on to how do you finish these things? This is the Henry Linick carving manual. I think I bought the last one at the school library or the school dispensary. It was what I trained with. I'm not particularly artistic, so I need a systematic technique for creating something like a molar. So if I can carve in planes, and that's what Henry Linick's manual taught me to do, then I can get that tooth to the right from the one on the left. And we could start with a square block and I could do it. So a special thanks to him for his well thought out protocol. I don't know how many schools still use this. I give this to all my first year students in a PDF so they can see how this is going to affect their carving. Here's a typical page out of there. What I'm showing you here is what I went through when I developed the Raptor burrs. So look at that one on the left there, way too pointed, cuts too deeply. David Clark at BioClear would go nuts if he saw somebody applying that because he thinks that's gonna screw up his compression dome, and I agree with him. Look at that one, that matches the angle of the cusp. That's the original Raptor burr. Now look at the finish though. If you use a concave foot or a convex football, you're gonna concave the surface when you adjust it, and you're probably gonna end up scraping some enamel. Whereas if you have a Christmas tree shape, you won't concave it, but on this particular type of burr, we could not put a safe zone or safe edge on it. So again, look at the difference. If you're using a round burr, you can severely ditch the occlusal surfaces. And again, footballs, convex are going to create concave. Pay attention to that upper right because that's the appropriate angle. It's the 21B angle. It's about 97 degrees. We actually got a patent on it. And notice what happens when you compare it like to bicuspids. Fits very nicely in there. All we need now is a limit stop so we can't carve too deeply. And also that limit stop can serve as a safe edge. And on the Christmas tree, I want to put a safe zone on there. So the only thing that's going to polish is the tip. So we're thinking all the time. Now, the problem was Kerr, who made these burrs for me, could not do a safe edge, a limit stop, or a safe zone. I don't know why, but they couldn't. Look how all these angles match and how easy it is when you have a nice surface like the Christmas tree to not gouge it out. No concaving. And regardless of which bicuspid or how you view it, it's going to match those cuspal angles. No good substitute. There's no substitute for good anatomy and functional occlusion. The Linux manual really taught us planar carving as the basis of morphology. So here it is, the 21B, the fabled 21B. We used that with amalgam. It was quick to make good anatomical shapes. We also use it with composite restorations. It's a fast way to carve planar anatomy in amalgam or unset composite. Now the difference is why don't we just turn it into a rotary version so we can do what we're doing here in alloy. We're sculpting it, we're carving in planes. Once we have the planes, then we can finish the planes and polish it, and we have that. So now let's convert that to a rotary for hard polymerized composite. Remember, we want to do monoblock. Monoblock's the strongest. So, well, when you market something, you need an acronym. So how about rapid, adapting, precision, transformer for occlusal resins, or Raptor? This is Bob White. I sent him that Raptor burr thing and I didn't tell him how to use it. I said, Bob, figure it out. See if you can. So he drew this and sent it back to me after he did all of his wonderful shaping. He very quickly figured out, I said, I'll give you a hint. It's like the 21B for amalgam. And the point that he's making here is you never go all the way through one way. You start with your 3 major pits and you work halfway to the next pit and then go to that next pit, go halfway back. If you're going out the buckle groove, you'll go up to about the cuspal line and then you work from the buckle back toward it. And that's how you create those nice elegant grooves. So always halfway. Don't go all the way through like a snowplow. You want to preserve the triangular ridges, the oblique ridge, you want the transverse ridge. All that stuff is easy to do with the proper shape of the burrs. Again, I apologize, in my first Raptor burr, I could not put a safe edge on there, a safe zone or a limit stop, but what we were able to do is good basic anatomy. This is Bob's. He placed the secondary anatomy with that little acorn and polished it. Now, the best polish, in my opinion, for composites is Dental Ventures of America Compodots. It's what we use when we train in the clinic. By the way, Joe Blaze used his Raptors and he said about 50% of his finish time was taken off the posterior composites. Dental Advisor gave us the highest rating, 5 stars, for the Raptor system. The problem is, CRA also rated Raptor size. The problem with it was we couldn't safe edge and safe stop it. So the first generation of occlusionators came out. And again, this is my patented product. So full disclosure, this is made by Strauss Dental. They figured out how to put that safe edge on there for me. It's all about the masking and taping to make sure that you can get, once you get the blank made, you can get the diamond where you want it and keep it off where you don't want it. So this was Michael Miller's first first look at it. So CRA now has evaluated that in the posterior Packer sculptor. One evaluator said, "Oh, Raptors with trainer wheels." Okay, yeah, that's exactly what it is. KOLs from here in dental economics just said, "What would I do differently? What could I do differently that would make a difference?" It's good to know that there are other people at different levels of skill set and thought have the same problems we all have. It just never allow yourself to get stuck in a rut. So what this was about is how these leading dentists can save time without sacrificing quality of care. What I found interesting here is Josh Austin is talking about back-to-back composites. How does he matrix it? Well, he finishes one and then he pulls that matrix out and then he does the other one. The only thing I would add is that if you stuff Teflon tape, plumber's tape in the box of the one you're not going to fill, it will hold that band in a good shape while you're filling the first tooth. Then when you go to fill the second one, just take the matrix off, remove the Teflon tape and fill the other one. Just makes sense. Here, Ian is talking about the convex footballs yielding concave occlusals. He doesn't want to nick anything. So he's saying truly prescriptive by size. Here's BioClear done after I sent occlusinators out. Now this is, again, minimally invasive. Get all the stuff out of there, create a nice enamel rim, and then fill it and carve the occlusal. Pretty darn nice restoration. You aren't going to pack food on that. So this is what we came up with. We made the instrument and then we followed it with the burrs. The secret again is that 97 degree angulation. It will fit all posterior teeth and you can quickly sculpt primary planar anatomy, or you can just put the 3 starting dots in central pit, marginal ridge pit, distal marginal ridge pit, and then sculpt it with the burrs. Because as you can see, the burrs have the same angle. So here's that posterior Packer. Pretty obvious how it works. You got a big ball burnisher, you got an acorn burnisher, and you got 2 Packers, 1.5 and 0.8, which pretty much covers everything. You can use this for amalgams. It works beautifully for amalgams if you're still doing some amalgams. And a nice grip, weighs just 1 ounce, fully sterilizable. There's the tips, 4-to-1. Rather than handing instruments back and forth, just flip it. Ideal for fissurotomies. Here what we're showing is pack the box, overfill by about 10%, and then burnish it with that big ball burnisher, and then quickly. I just put 3 dots and let the burrs do the work. I don't want to sit there and fool around, push composite around. Remember, we talked about Christensen's comments about don't be pushing composites around. You could pull it away from a margin and not even know. Your burrs will do the work for you, but use the 21B acorn to at least get the countersinks. So this is what we're talking about. Easy composite sculpting. You got that diamond-free safe edge or the safe zone that allows maximum control. That 21B shape is going to carve perfect anatomical angles. You can't overcarve with the safe edge or the limit stop. And the adjacent enamel areas aren't damaged. So you got 50 micron diamond on the acorn. You got a limit stop here. It's also a safe edge or zone if you bump into enamel. There's a safe zone on the 15 micron finishing Christmas tree. So you can actually copy key. You can be resting that non-diamond on the enamel and finish the planes that you sculpted with those acorns. And most of my comments on the 4 pages of testimonials is that I don't even polish them with stuff anymore. So how do these work? Here's an indication for each of the burrs. Small acorn, pedo restorations, fissurotomies, box, or slot preparations. Medium is going to be for the first time restorations, maybe 1.5 to 2 millimeters across. And then you got the large acorn. That's got a big safe edge and limit stop on it. That's for the big ones, the 2.5 to 3 at the across at the cusp line. Wider safe edge, limit stop to prevent going too deep or nicking. The large acorns also well suited for BioClear restorations. So the sculpting burrs, fissurotomy, you can see how that safe edge is going to engage, or the limit stop. There's a class 1 or 2, and there's a large class 1 or 2. Use the safety, the sculpting burrs, like a child's game of dot to dot. Connect the dots, make the 3 primaries, and then go halfway, always halfway to the next dot. So like I said before, I just take that instrument and make my starting dots, and then I follow up with my 50 micron diamond because I want to go fast, and I can with this. I don't worry about overcutting or nicking enamel because I've got these safe edge, limit stops, and safe zones. So the indications for this is what we call a 50-50 Christmas tree. You've got more than enough safe edge. You can use that to finish the smaller class 1, 2, and 5s. It's only 15 micron grit. It's gonna that's gonna touch the composite. An 80-20 Christmas tree here. That's going to be for the larger ones like the BioClears or even large class 5s. So this is how it mates with that situation. You can see that that safe edge is going to be what's contacting on the smaller filling, the enamel, whereas on the larger one, you're going to use that 80-20. And this is what it looks like on a tooth. Here's a class 5 Christmas tree burrs on a class 5. Small and large, no enamel nicking. How do I polish this? This is called Compo Dot. You take the dot out and you run the brush into the pellet like rouge. We have found, like on big class 4s and composite laminates, that we can use a brownie, a greenie at 150 to 100,000 with lots of water, and then run this Dental Ventures of America, run the brush into the pellet like rouge, and we get the highest shine for not a lot of money. So again, apply to the surface, light touch, 20,000 RPMs after you use your brownies and greenies. The nice thing about using a brownie and a greenie, if let's say you want to trim a little bit of composite off and you don't want to use something like a 30 flute or a 12 flute or a diamond because you don't want to touch that enamel surface, the brownie at about 100,000, between 150 and 100,000 will not cut enamel, but it beautifully cuts composite, anybody's composite. Lots of water though. The electric handpieces were made for that technique, in my opinion. So here's the brush. Notice it's latch. It's a Robinson brush on a latch. It reaches all the posterior teeth. 20,000 RPMs with a light touch. They're autoclavable. They can be used on ceramics and gold. Also sold by Dental Ventures of America. That's primarily a laboratory materials company. When you have zirconia you want to polish, you want to use these brushes, and the next thing I'm going to show, which is the buff on zirconia with a compound called WOW, W-O-W. Dental Ventures of America makes that process, that material. It brings that zirconia up shinier than if it was glazed. And it's a much better, kinder surface, polished surface to oppose against enamel. So here's your, this is the buff wheel, again, autoclavable. I just run it into the pellet. I'm going to use that after the brush, 20,000 light touch. And again, I can use it with ceramics as well as gold. Dental Ventures of America. I didn't put them on the list of vendors that will give you a discount, but I want you to go ahead and call Dental Ventures of America They're down in Southern California, and tell them you attended my lecture, and they will give you a 15% discount on all their products. Don't miss out from this because it's really a great system for polishing. Composite gold, zirconia, Emax. Now this is a brush I like. I actually brought this brush into the country. It was from Bruno the brush maker through a guy in Florida, and to Ultradent. Dan Fisher saw it and loved it. He still sells it. This is really great for occlusal areas, the deep occlusals. I just run it into the compo dot and then run it at 20,000 RPMs. So here's a little quick video for you. This is Activa. Watch how fast it is to fill this 10% above grade, allow it to set 3 or 4 minutes, then auto cure, compensate for the C factor, then light cure 20 seconds and sculpt with the occlusionators. It's a quick video. So notice I'm going into the box. I'm going to keep that flow going. I'm never going to stop the pressure on the flow. This is how fast this system is. Now, obviously, this is not going to be sculptable because I don't want to disturb this. Once it's in there, all I'm going to do is brush it onto the margins to make sure that I don't have any gaps. Sorry about the filming here. This is our newest guy. Now we let that set 3 or 4 minutes, and then we'll light cure it. Now watch how I get stopped when I start to go too deep. The beauty of it, and I'm already now finishing, it's very quick. Polishing, I'm going to finish my marginal ridges. This is Activa. I'd be putting this into a meth mouth or anybody who's really having, there I'm doing my 5th cusp. The distal groove. Look at the anatomy you can do very quickly. There's the Henry Linick carving manual. Now let's look at this. Here comes bulk easy. Again, quick. I don't know why I decided to do this, but I thought it was a good idea to do a little ball right on there. Okay, so no big deal. Now this should be a 19 gauge needle. Works best with this. That's what Michael Miller found. So now I'm filling that cavity very quickly, never taking the pressure off the plunger. I want the material to push me out of there. I want to be about 10% above grade. Then I'll brush it, let it sit for 90 seconds, and then I'll hit it with the light. I have absolutely mitigated C factor with this material. So I'm just brushing it because it's still setting. It's a bend brush, cheap, easy, inexpensive, fast. Okay, so we let that set. Here we are. What I'm doing here for the student is just showing them how we're going to make the 3 dots, and then we're going to connect them. Kind of silly, but you know, when you're teaching, you want them to understand the concept. So I'm just drawing the lines where you're going to go. Notice I have not done anything with the acorn on the PPS instrument. I'll use that when I use a bulk packable. So now I'm going to be using the 50 micron acorns very quickly. Takes me, there you go. That's the medium size one. Okay, look how I get stopped by the limit stop. If I go out to the side, I'm going to hit that enamel with a non-diamond zone. Turn it just a little bit to make the groove. Again, 10% overfill. Very quickly, just like you're sculpting amalgam with a 21B. There's my distal buckle groove, 5th cusp. I'm diddling right now. I should be moving on to the 15 micron. So now the 15 micron. And that's pretty big filling, so I'm using the 80-20. Again, I'm rolling it, always rolling it. And this is going to give a very highly polished surface on that restoration. So you can see I've already got some pretty darn good anatomy in there. Finished with the discs. and roll over the marginal ridges. This is where it's critical to have a good matrix band. I like the matrix band that will give me a high enough rounded marginal ridge so I can just roll it and make it very flossable. So these are quick. This is a quick way to do dependable composites. And again, now we're doing our finish. That's the 15 micron, just redefining, making sure everything's good. If there's going to be any high occlusion, it will always be on the zenith lines. The zenith lines are the planes that are formed, the line that's formed by two planes meeting. So there you go, some nice Henry Linick anatomy. If I want to do a little occlusal adjust, I like this little one. Or I can use it if I really want to get fancy and put some secondary anatomy in. Why would I do that? Probably no good reason. Just because it's there, I guess. Okay, so we're done with that one. We got some pretty good anatomy in there. Little Linick carving manual anatomy. Now here's your paste fill. And away we go. One fell swoop. Fill-Tech 1. So now I'm gonna have to pack this material. So I'm gonna start with the large packer. There's my burnisher. Start with the large packer, make sure I'm down where I need to go. This is not heated material at this point. This is a regular bulk fill 1 packed cold. So now I pack. As soon as I know I've got all the edges, all the marginal areas and the box form packed, then I flip it around and I burnish it, just like I did alloy. Push it in hard because I want to make sure I don't have any gaps. And then I'm going to monoblock it. I'm not even going to bother put indents in there because here I go again, my 50 micron, that's Fill-Tech Supreme. You can see how fast that cuts. Lots of water with this. You have to use lots of water. So finishing the planes now that I carved, and then pull out the matrix. Let's see, pretty nice tight contact. And then finish your marginal ridges. Getting fancy again with that little one. And there's your anatomy to match the other teeth. So again, here's what makes this system safe for you. You can't cut too deeply with it. You're going to be able to fill about 10% above grade. And that's straight out of the mouth of Frank Milnar as well. He's the one that started this 10% above grade stuff. He's a senior mentor with BioClear. He's also a heck of a good compositologist. If you get a chance, he's going to be up at Pacific in October, I think October 2nd. And that's going to be a hands-on 2-day course. He is absolutely worth going to, especially because Frank teaches the best pink composite replacement for gum tissue that I've seen. You could be conversational distance from a person he's treated. You would not know that's pink composite on the route. Well worth coming to his lecture just to see that. And he does a different twist on BioClear. He's not the straight BioClear out of the gate guy. He's got his own way of doing things. And he's really taught me quite a bit. And I appreciate the fact that I can send this kind of stuff to him and he's gonna comment on it. So the safe edge, you can't nick peripheral enamel and it's gonna prevent you from cutting too deep, but always use copious amounts of water. And again, safe zone prevents nicking of the enamel. Christmas tree polishes the planes that the acorn occlusionators form. That's the whole deal. Let's take the time off. Let's create some nice anatomy quickly. Roll over those marginal ridges. God, my last slide, you build houses in my woods. I'm gonna swim in your tiny lake. Ain't that a fact? Oh, where are the fish? Thank you. Here's the product list, Ultradent, Danville. All these companies have agreed to give you a discount for participating in this. The only one I missed on there, and I feel badly about it, is Dental Ventures of America. Just tell them you attended my virtual lecture and you saw the wow and the compo dots, and they will accommodate you. Any questions?
Looks like I don't see any more questions. I'm just double checking right now. God, what a great presentation. I want to thank you so much, Dr. Roetzer. I really appreciate your great lecture tonight.
Well, thank you very much. I'd like to think there's more questions. This ain't the Gettysburg Address. There's got to be someone out there thinking, what? Come on.
Well, I'll give you credit. I look at participants and everybody hung in there tonight, so I'll give them credit for that. That's a great sign. They were paying attention.
Oh,
So
good.
That's a good sign. I saw everybody, no drop-offs.
I had to go a little fast, but that's the way it is.
You got it all in. I want to make sure I want to thank also everybody for joining us tonight, and hope you found this information as helpful as I did for sure tonight. This meeting has been recorded. It'll be emailed and posted on our San Mateo County Dental Study Facebook page. And with that, I always want to stay safe. Everybody stay safe out there. Oh, do I got something? Oh, I got a question. Wait. Oh, let's see. Oh, nope. No question. Sorry about that. There's somebody else chiming in to thank you. Just want to make sure I thank the doctor for the presentation, which I will, from Derek and our group. Stay safe out there. Enjoy the rest of your evening tonight. And we'll hope to get together soon.
Thank you, Brad. Thank you.